Welcome to Speak Life with Dr. Amy Chai. Information for your best life. Now, here's Amy Chai.
Hi, everybody, and welcome again to Speak Life. And I am Dr. Amy Chai. And are you taking blood pressure medications? Because if you are, I would like for you to go ahead, grab them, and we're going to learn a little bit about your blood pressure medications today. We're going to talk about, how they work. We're going to talk about the potential side effects, who should and who shouldn't be taking them, and that sort of information. And it's hard. It's hard because, like, your doctor may say, "Oh, I'm going to put you on an ACE inhibitor," right? And then you go to the pharmacy and you're like, it says lisinopril, and lisinopril is an ACE inhibitor. But you have like the category name, you have the brand name sometimes if it's a branded drug, and then you have the generic name too. And sometimes it's hard to, get those straight in your mind. But when you pick up your prescription bottle, what you're going to see on there is actually going to be the generic name of the drug. And so that's the one we're going to talk about today, is the generic name of the drug. And we're also going to talk about kind of broad categories of types of drugs. And there's a lot of different types of drugs within each category. And all of them together are antihypertensive drugs to treat blood pressure. Now, some of these drugs are also used for heart disease. Some of them are used for things like migraine headaches. Some of them are used for other purposes, even for anxiety. But we're going to talk about how they're used for your blood pressure, okay? And the other thing that you'll notice is when you go to the pharmacy, like, you'll get a bag, right? And stapled to this bag, you're going to find like a whole sheaf of papers. And you're going to look at the papers and you're going to be like, this paper says that I might grow 2 heads, or like my eyeballs might fall out, or, how can I have both constipation and diarrhea from this medication? Or, this is a medication that's supposed to treat my headaches, but yet it can cause headaches. And there's like 100 different things listed on this sheet of paper. And you're like, I'm not going to read that. Who reads that, right? I don't read that. I don't read that. But there are some side effects that you should know, and we're going to talk about those. And all the rest of them would be very rare, and depending on the person, because everybody's a little bit different. Some people will have different symptoms, but the more significant side effects we're going to talk about today. Also, kind of as the other thing I wanted to say before I get into talking about the medications is that taking a pill for high blood pressure is not magic. It's not magic, okay? It does reduce your risk of having certain outcomes like heart attacks, strokes, kidney disease, right? We talked about that last time. And if you didn't see my previous show on hypertension, you can go ahead and watch that next. And it talks a little bit more in depth about what high blood pressure actually is. But when you have high blood pressure, treating the high blood pressure, it reduces your risk of serious events such as strokes and heart attacks and kidney failure. But taking the pill, like I said, it's not magic, because you still have to change your lifestyle to get the maximum benefit. And if you change your lifestyle enough, you may actually be able to stop taking the blood pressure pills. So this is a very big incentive. If you can make it work naturally, that's even better for you. And again, looking back into the last video, you're going to learn about low sodium, which is low salt, avoiding the processed foods, eating a lot of fruits and vegetables, getting a lot of physical activity in, avoiding smoking, avoiding alcohol, avoiding street drugs. So those are all things that will help your blood pressure. And maybe if you do well enough, you might be able to stop a blood pressure pill. That happens. So I feel like it's great to be able to learn a little bit more about the pills that you have. And if your blood pressure is, say, over 140, over 90, chances are good that your doctor is going to recommend a medication. And when I say when it's over 140, over 90, and remember the top number, the 140, that's when the heart is squeezing. That's the highest blood pressure point. And the 90 is when when the heart relaxes, that's the lowest blood pressure point. So 140 over 90 is what we call stage 2 high blood pressure. And that's the stage at which we're going to treat your high blood pressure and give you a medication. So that's the range of blood pressure that I'm talking about today. And some people do get their blood pressure treated at lower levels if they have diabetes or heart disease or something, but I'm just talking about the average patient. Okay. So what I want to do today is start going through and talking about drugs one at a time. So the first drug that I would like to talk about is called a calcium channel blocker. Now, the calcium channel blockers prevent the calcium from getting in through the blood vessel to the muscle that's around the blood vessel. And so what it does is the muscle around the blood vessel relaxes and it allows the blood vessel to open up and relax. So the calcium channel blockers, they relax your blood vessels. It makes the blood pressure go down because your blood vessels are a little bit larger. And there's 3 different classes, and I divided them into 2 parts. The top one is the type of medications that ends with apine, which is like amlodipine, but there's also nifedipine, nicardipine. There's other medications in the class, but amlodipine is going to be your most common one. And if your bottle says amlodipine on it, this is what it does, okay? It relaxes the blood vessels. Now, what type of side effect do you get from amlodipine? Well, this whole calcium channel class often has a problem with ankle swelling, and it is dose dependent. The higher your dose, the more likely you are to get ankle swelling. So if you recently began taking amlodipine or one of these other calcium channel blockers and you notice puffy ankles, it's probably due to the drug. And water pills don't help it. The only thing that would get rid of it would be lowering the dose or discontinuing the drug. Sometimes adding another drug in with it can help reduce the swelling. So that's the main side effect of amlodipine, is actually the ankle swelling. It's convenient to use because you don't have to worry so much about things like watching your potassium. So it's often a first line drug for people because it's easy to use. Okay. And most people tolerate it really well. The other types of calcium channel blockers are the ones represented by diltiazem or cardizem and verapamil, okay? Now, these two types of drugs, not only do they relax the blood vessels, but they also relax the heart muscle. So the heart doesn't contract as hard and it reduces the conduction a little bit. So it maybe slows down a little bit. So these two medications also have the cardiac effects, which is especially good if you have heart disease. Some of these medications we use to prevent migraines as well, but but it can actually also cause headache. So that's another thing to think about. These medications also can cause constipation, and that can be annoying. You want to make sure you keep yourself hydrated. Um, and it can also cause dizziness. In fact, most of the blood pressure medications that I'm going to talk about can potentially cause dizziness. But these calcium channel blockers, amlodipine is the most common one. They are often one of the first drugs that doctors are going to turn to treat high blood pressure. The next medication that I'm going to talk about is called the ACE inhibitor or angiotensin receptor blocker, angiotensin receptor blocker. So these two classes of drugs are very similar. The drugs that end in pril and the drugs that end in sartan, like lisinopril, enalapril, captopril. All these drugs that end in pril are ACE inhibitors. And sartan, like losartan, valsartan, olmesartan, the sartans are angiotensin, receptor blockers. So the way these ones work is the pril drugs work by preventing the formation of a molecule that causes blood vessels to tighten down and constrict. And whenever blood vessels tighten down and constrict, your blood pressure is going to go up. So it relaxes the blood pressure when the blood vessel walls are bigger. So it prevents this molecule that constricts the blood vessels, excuse me. And then the other one, the sartans, basically do exactly the same thing, except instead of removing the molecule that causes it, it acts on the cells that are affected by the molecule. So the prils and the sartans both allow the blood vessels to be larger. Now, these medications are very commonly used in people with diabetes or kidney failure or heart disease. And so these are very often used as first-line drugs. So if you do have high blood pressure, chances are good that you have been on one of these two drugs. Now, the pril drugs like lisinopril do have more side effects than the sartan drugs. The pril drugs, about 1 in 5 patients are going to get a dry cough, okay? So the dry cough, if you have to stop the lisinopril and call your doctor before you do anything like that, if you do have to stop it, it can take 2 to 4 weeks for the dry cough to completely go away. A more dangerous reaction that you can have to drugs like lisinopril is facial swelling, okay? And if you do get facial swelling, then you should never take the pril class of drugs ever again. Now, the sartan drugs don't typically have the cough, and they don't have the facial swelling either. But they do have similar side effects in that they do sometimes make the potassium go high in the blood. So with these drugs, we do have to follow the potassium. Potassium goes up in this type of drug. And why is that important? It's important because there's another drug where the potassium also has to be checked, where the potassium goes down. And the potassium goes down in water pills. Now, here's this wave of water. You can see the water flushing the potassium right out of your body. And it can also flush out things like calcium, magnesium, things like that. So there's two types of water pills. Some are weak and some are strong. The weak ones I'm going to call the representative drug is called hydrochlorothiazide, or HCTZ. Okay. Now HCTZ, or hydrochlorothiazide, that's probably that's the longest drug name, but it's also a very commonly used drug. It does decrease the potassium, and a lot of times used in combination with a sartan or a pril, which raises the potassium. You get one drug that raises the potassium, another one that lowers the potassium, and sometimes it does balance out. So the thiazide or hydrochlorothiazide, you'll often hear about, maybe you should eat a banana, maybe you should have an orange, maybe you should have a potato or a tomato. Those are substances that have a lot of potassium in them. There's another similar drug. It's called chlorthalidone, which is actually a better drug, but sometimes it can cause more potassium loss. So sometimes people are a little bit more hesitant to use it, even though it's a better drug. There are some issues with hydrochlorothiazide and also with Lasix. People that should not take water pills include, if you have gout, okay? So gout is where you get these like red, swollen, hot joints that are really tender. But the water pills can make your body retain a substance called uric acid, okay? And it can make your gout worse, okay? So if you have gout, you have to be very cautious with the water pills, okay? Also, if you have diabetes, you have to be a little bit more cautious with the water pills, because it can sometimes cause a little higher glucose level or a little higher level on your cholesterol and lipids. So there is a little bit of, playing around that you need to do with these medications to make sure it doesn't interfere with another disease that you have. Now, the other example that I have here is furosemide or Lasix. And Lasix is a strong water pill. It will make you urinate a lot. And in fact, we used to call it Lasix, like lasts 6, it lasts 6 hours. Like you're going to urinate for 4 to 6 hours. And you're going to urinate a lot. So this is not the best commuter drug. If you have to drive to work in traffic, you might have problem with Lasix, but it's good if you have like edema, if you have any kidney problems where your kidneys just don't put off enough urine. Just the Lasix will just get rid of that extra fluid that's in your body. Now, for the water pills, it's particularly important to have your potassium checked regularly. Whenever your doctor tells you to check your potassium, you need to understand it's important, because too high or too low of a potassium level can actually be deadly. So that's why your doctor is always wanting to check your blood. So don't say, oh, why do I have to get my blood checked? Just get your blood checked, because we don't want you to die. So that's a very important thing with water pills. The other thing is that there are some cross reactivity between, if you're allergic to sulfa drugs like Bactrim that you might get for a urinary tract infection. If you are allergic to those sulfa drugs, you might also be allergic to like the hydrochlorothiazide drugs, because they have some similarities, and you could also be allergic. So tell your doctor if you have any allergies. Okay, so that is really important. And the next slide I want to talk about is the fourth common class of blood pressure pills, and that is called beta blockers. Now, beta blockers There's alpha blockers and beta blockers. Okay. So beta is a receptor that actually binds to a chemical called adrenaline, which is like epinephrine or adrenaline. It's that substance. It's a hormone that your body produces to help you run away from danger. It's your fight or flight hormone. So these adrenaline hormones, they just attach onto your beta receptors. And what happens if you're really nervous? Think about it, okay? You start to sweat, you start to run fast, your heart starts to beat really, really fast. You might shake, you might have diarrhea. There's a lot of things that happen when you're very stressed or anxious. Now, the beta blocker calms everything down. Okay. And I put 3 different groups here of beta blockers. The simplest ones are just going to affect the beta blockers on the heart. That would be metoprolol and atenolol. What that does is it slows the heart down and it makes the heart pump less hard. So it calms down the heartbeat. Okay. And these are commonly used in people who have heart disease as well as high blood pressure. The second one, propranolol, is a beta blocker that actually crosses over into your brain. And your brain also gets those fight or flight hormones. If you have anxiety and you're like trembling and pale and, all anxious, the medication called propranolol can actually help you calm down. So it will get rid of those symptoms of the palpitations and the trembling and the sweating and stuff like that you get when you're super nervous. So sometimes we'll give a little propranolol. People can take it before, like, they're going to give a speech or something where they're going to be really nervous. The other medications would be the carvedilol and labetalol. Those are stronger than the others because they also affect the alpha and the beta blockers. And those are other types of beta blockers. So there's a lot of different types of beta blockers, and they're used for a number of different purposes. But for high blood pressure, we're usually going to be using the metoprolol or the atenolol. That's the simplest one. So what kind of side effects are you going to see with beta blockers? Okay. Well, think about it. It's going to be opposite of what you get in fight or flight. So if you get like diarrhea when you're nervous, the beta blocker might give you constipation. If your mind starts racing when you're nervous, beta blockers might give you a little depression. They might also give men some sexual dysfunction. They can also slow your heart rate down. And a side effect of too much beta blockers would be too low of a heart rate. So these are the potential side effects that we get from the beta blockers. These drugs are very old drugs. They've been around forever, and they're generally quite safe. So I would say that probably the first line drugs are going to be the ACE or the ARB, the water pills, and the calcium channel blockers. And the beta blockers tend to be like a second line drug or an add-on drug most of the time, unless you have some heart disease or some other reason that you need to be on a blood pressure medication. Now, I want to make you aware of something about beta blockers, okay? You should not stop them suddenly. If you stop them suddenly, you can have a rebound high blood pressure that can be dangerous. So you should sort of taper off the beta blocker before you stop it. And you should never just stop a medication. You should always tell your doctor. Like if you're having side effects or something, don't just say, oh, I'm having side effects, I'm just going to stop this drug. No, don't do that. Tell your doctor and let your doctor just taper you off the medication, switch you over. Do it safely. Do it safely. And that's why we want you to say, oh, I'm having side effects, and then come in and talk to us. Let us know what problems you're having so that we can fix the problems, okay? So the next thing I want to talk about here is something a little bit different, and that is how blood pressure medications are going to be different depending on what type of illnesses that you have. So I just want you to know, very importantly, a lot of people are on the drugs like lisinopril and losartan, those ACE inhibitors and angiotensin receptor blockers. A lot of people are on those, but do not take them if you are pregnant. Do not take them if you're pregnant because they cause birth defects. Tell your doctor if you may become pregnant or you're even thinking about being pregnant when you're talking about blood pressure pills, because that is not going to be safe for you to take in pregnancy. What if you're like a diabetic patient, though? The angiotensin, the ACE and the ARB drugs, those are going to be your first choice because those drugs are excellent for protecting your kidneys. And they're also excellent if you have risk of heart disease. So the ACE and the ARBs, they're very good drugs. And if you are diabetic, you have heart disease, chances are good that you're going to be on an ACE, ARB, or an ARB type of drug. And you don't want to be on both of them at the same time because they both do the same thing. So don't do that. So for older people, you have to be careful because the dizziness that people get is real. And when you're old, a lot of times, you can get wobbly on your feet, and to have a fall and break your hip, it could be a very life-altering scenario for people. So the elderly, we often start them on the mild water pill at a very low dose. The motto is start low and go slow. Just give like a little bit at a time. Make sure there's no side effects. We have to be very careful with the elderly when we're talking about blood pressure. And then finally, if you have that kind of genetic high blood pressure, where a lot of people in your family have high blood pressure and you're on a whole bunch of medications and they've looked into it, they can't figure, why the blood pressure isn't getting better. Spironolactone actually might be the drug for you. Spironolactone is actually a potassium sparing diuretic, which means it can cause your potassium to go up. And it also fights a hormone that makes your blood pressure go up. So a lot of people with hormonal problems may benefit very much from this particular medication called spironolactone. So that's why different people have different types of medications. And that's why your doctor is going to try to tell you like what medication is going to be the best medication for you, because everyone's different. Okay. And sometimes you may have to switch a medication, or you might have to change the doses of a medication. And one of the things that I like to tell people is sometimes it's better to have 2 low dose medications rather than 1 very high dose. Because sometimes going up and up and up on the dose isn't going to give you a lot of added benefit, but it will give you more side effects. So if you want little bitty side effects and you're working on different types of drugs, sometimes 2 low dose drugs might actually do the trick better for you. But again, I want to recommend that you still follow your lifestyle changes that we talked about. And that's really key to making your blood pressure medications work. And now I have to say, I did skip a few blood pressure medications like clonidine, like prazosin, like hydralazine. There are other blood pressure medications out there, but those medications are not super common. So what I did was I actually talked about the 5 most common types of blood pressure medications that are out there. And if you have high blood pressure, you're pretty much certain to be on one of those 5 categories of high blood pressure medications. So I really hope that this has helped you to understand a little bit more about your treatment that you're getting for your high blood pressure. Um, Always remember, take your blood pressure medications as prescribed. Um, Make sure that you don't take two accidentally on the same time. Never stop them suddenly. Always talk to your doctor if you have side effects. And then you're going to be able to deal with those blood pressure medications. You're going to be able to understand what you're doing with the blood pressure medications, and it's going to help you to help yourself. So I hope that was useful, and I can't wait to see you next time on Speak Life.
Tune in next time for Speak Life with Dr. Amy Chai at ctpolitics.tv.